Absolutely, yes.
Yes.
Sex differences are there.
This is hugely important.
Sex is a fundamental biological variable, and it is not considered that in most basic science studies, and really considered a covariant in many of the clinical studies. We have to take it seriously because it is such a fundamental genetic variable that accounts for all physiology and pathophysiology. To ignore it is just bad science.
I think you only have to look at trends of cancer by men and women and see the huge discrepancies. Esophageal adenocarcinoma, for example, one of the cancers that I work a lot in, has a sex ratio of about 8:1. So for every single female that develops this cancer, about 8 men do. And the reasons for this are really poorly understood.
If you think about one aspect of biomedical research that looks at neuropsychiatric disease or neurodevelopmental diseases, that there are inherent sex biases in all of them, whether it be onset, duration, treatment, resistance, etc.
And it took us too much time to understand that men and women differ in so many aspects, and actually in virtually all bodily systems are different.
There's not enough understanding as to how men and women are different, especially when you're developing drugs, understanding mechanism. Most of the time, a lot of these studies are only in men, which can be bad if you have a disease that is more prolific in females, like autoimmune disease, for example. So the study of sex differences is hopefully going to help answer those questions, so you can help develop that better drug that can be more personalized to a man or a woman, not just, say, a 30-kilogram male.
There are sex differences at all levels of brain function, down to the level of single neurons, down to the level of ion channels. There's evidence that ion channels operate differently in males and females. But even though it's everywhere, it's been largely, by and large, ignored. Neuroscience in particular is the worst offender. 93% of the animals studied in neuroscience are male. But the conclusions are drawn equally about males and females. Maybe that was a valid strategy 20, 30 years ago. It is no longer, because of the evidence that indicates that sex differences is important, often in ways that we completely didn't anticipate. But that doesn't make it unimportant. It just means we didn't anticipate it. So it's hugely important because the data already make it clear that sex differences are everywhere in brain function, in body function. We've been pitiful as scientists at understanding this. We've been great at dismissing it, pitiful at understanding it, and we need to be better at understanding it.
We have in Modena a culture of analyzing sex difference, gender differences in medicine, because our school has been developing a program for studying sex differences from more than 10 years.
There is a lot of research that has shown that they respond differently. We know that in the human literature there are some disorders that are more prevalent in women than in men, and I think it's really important for us, if we want to help cure these disorders, that we first understand why these differences arise and when they arise.
If men and women get a disease differently or in a different ratio, you can find out more about the disease by studying the differences and how that works.
The study of sex differences is hugely important, even though many people in my field don't realize that yet. And a great function of this society is to help people to realize that.
Practically every organ, heart, lung, blood, all are different in men and women, and we need to understand what those differences are and what the implications are for prevention, diagnosis, and treatment.